Hi, good evening, everyone. This is Dr. Dwayne Scotty. I'm a physical therapist with Spark Physical Therapy. Thanks for joining, jumping on. We're here live, here to really talk about any running-related questions you may have. Specifically, we're going to cover the best exercises that you can do as a runner. So I did poll the audience today, and you did speak. The polls were pretty close. The two topics that I wanted to talk about today were either the best exercises for runners or what entails soft tissue care. And the votes are really close, but the best exercises won out. So I think we're going to talk about that today, but there was a good number of people who want to learn about what exactly is soft tissue care. So because of the overwhelming response, don't you worry. If you did vote for soft tissue care, then you will hear about that topic next week. So we will make that topic of conversation for next week. And then it's actually good for me to have that in advance so I can produce some content with you. Lisa's on, Janelle's on. Thanks for joining. Christina's on, Danny's on. So thank you for joining. Appreciate it. If you're here on the live, just type in live so I know you're here on the live. If you're watching this on the replay, hit team replay. Shout out to you for watching on the replay if you couldn't join us right now at 7:30. So we are starting to get some questions in, and if you do have any specific running related questions, specifically looking at what exercises do I need to perform, I want you to type those into the comment box right now. All right, so Lisa's saying that she wants to learn about stretches for shin splints. So we'll definitely cover some stretches for shin splints. All right, we will take care of that. So any of your questions that you could possibly have wondered, I want you to type them in. We'll talk about them. I will be here as long as you like to answer any of your running related questions. The other thing that I do want to know is really those of you who are on here live, I want to know about your experience. So this will help shape the conversation. If you are so there's really two different types of people that I help out a lot. Either we have our novice runners or some of our first time runners. So you're just starting to take up running, not sure, what to do. You're starting to learn about it, which kudos to you. I myself was an adult onset runner. So I've only been running actually 8 years. I talked about that story a couple of weeks ago, but those that are just taking up running, I give you ultra credit. I think everyone can learn to run as long as they do it correctly and safely. So I kudos to you for educating yourself and trying to learn more. So if you're a novice runner, just hit novice in the comment box there. If you're an experienced runner and you've run a couple of half marathons, you have a couple of half marathons under your belt, then just write in racer, right? Or write in marathon into the comment box. And just based upon the level that we're talking to tonight, I will kind of shape the conversation toward each of those. Andrea, thanks for jumping on. Andrea wants to know what exercise can you do to make your knees stronger to avoid injury and pain. So that is a very common injury that we see in runners is knee pain. So either pain on the front of the kneecap or on the side of the kneecap. So we'll definitely get to that. All right. So Andrea, thanks for your question here. So what we're going to talk about today. So we are going to talk about what types of exercises for you as a runner are best to perform. Also, we're going to talk about, should you stay away from lifting heavy? Should you stay away from weight training? Should you not be in the gym as a runner? So I get some questions on that. You might be wondering, if I bulk up, I add too much muscle, is that going to make me a less efficient runner? Lastly, we're going to talk about how many days a week should you be exercising. So we're going to get into that topic. So those are the three intro topics related to exercises for runners that I wanted to get into tonight, as well as any of the questions that you have that you're going to drop in the comment box. We'll answer those for you. So let's get right into it. What types of exercises should you be doing as a runner? So this is a challenging answer. The biggest thing is it really relates to going back to my underlying principle that I talked about a couple of weeks ago on the live, is that you need to train to run. So you can't just run as part of your exercise. So a lot of us have like fitness goals, weight management goals, whatever it is. You want to get healthier, you want to get more fit, and you want to run, take up running for that. So you can't just run. You need to actually train in order to run safely and in order to actually meet your performance goals. So to kind of stay injury-free or lessen the risk of injury or improve your performance, you have to do specific training. So what is that type of training? What types of exercises should that be including? The long and the short is that it should be a nice balance of strengthening exercises, stabilization exercises, flexibility exercises, as well as getting into plyometric training. So now if you are just a beginner, novice runner, I'm talking to you, you do not need to worry about plyometric training yet. We did talk about that on a live 2 weeks ago, I believe. And I have kind of put out there plyometric exercises for runners level 1. So if you're starting to delve into that side of things, plyometric exercises, then I would encourage you to visit my YouTube channel. Just search Spark Your Training and you will find that channel. You will find a specific playlist specifically for runners, and you will find level 1 plyometric exercises, 4 great ones, good starting point. I will be posting level 2 later this week or next week to kind of, for those who have been following along and started doing those level 1 exercises, you are ready for a progression at this point in time. So plyometric exercises, we're going to put those off to the side because we kind of talked about them. So let's kind of focus on flexibility first. Flexibility exercises are important, but they're honestly not the main culprit of the majority of the runners that I see who have running related injuries. It's not due to a flexibility issue per se. It is usually due to more of a muscle imbalance in terms of strength of certain running specific muscles. There are instances where you can have decreased muscle length. Specifically, I'm thinking hip flexors, I'm thinking calves. Those two areas can a lot of times lead to either low back pain issues, hip pain issues, as well as in the calf, the Achilles, the old common Achilles, as well as plantar fasciitis or heel pain issue that we see in a lot of runners. So those two issues can be problematic, but you know what? We're going to set that little issue, flexibility, off to the side. Let's table that because that will be great to integrate into soft tissue care conversation that we're going to have next week, right? Because you all voted for soft tissue care. So we will do that next week. So let's put that off to the side here. So let's really focus on stabilization, strengthening exercises. What types of exercises are best? First off, we need to target the right muscles. Now, what do I mean by the right muscles? I mean the muscles that you're using a lot of during your running to maintain proper running technique, proper running form, specifically keeping the pelvis level. When we run, we land on one leg. Every single step you take when you run is on one leg. When you're balancing on one leg, your pelvis needs to remain level. If your pelvis is not level and is like this, then that causes your knee to go inward. If your knee goes inward, that's where we start to run into those biomechanical problems that we tend to see with people with knee pain. So getting back to Andrea's comment with knee pain, a lot of times knee pain is caused by either issues at the hip, so muscle weakness at the hips causes the knee to go in, and then you do that over time. You run, you do 1 mile, 2, 3, right? You get up to 10 miles maybe, and your knee's going in constantly. That's going to eventually add irritation to the cartilage on the bottom surface of your kneecap. So we call that patellofemoral pain syndrome, but basically kneecap pain, right? So very common in runners. The other issue you can get is IT band syndrome. So you can get outside of the knee pain. So that's kind of the main differentiator in when we're looking at diagnosing those two, is pain location is a big key to diagnosing those two. But you can have issues with the IT band because the pelvis is not level when you're running. So if your pelvis drops every single step you take, then that puts a lot of stress on the knee area. So when we're looking at what are the muscles that are responsible for keeping the pelvis level, those are your hip abductor muscles. So specifically your glute medius. So the muscle on the outside of your hip, that's the muscle that you're going to see that prevents your knee from going inward. So kind of, Andrea, going back to your question, strengthening your hip abductors, I would say strengthening your hip external rotator muscles. So the muscles in the deep part of your buttock, those muscles prevent rotation of the limb as it goes in. So with every step that you take, knee goes in, that causes knee pain. Strengthening those muscles will help to prevent that in the mechanics. So we got my buddy Jay jumping on. Thanks for jumping on, Crafty. Andrea wants to know, how do you know and how can you manage the pelvic balance to keep everything balanced? So very good question. How do you know if your pelvis is staying level? So one of the things you can do is you can actually, now I'm not a big fan of treadmill running. We've talked about that in the past as well. But for just looking at some basic technique, it is nice sometimes to get some feedback. Or what I would recommend, honestly, is you run. So in videotape, you record it, and then you're able to actually look at your pelvis. And it'd be nice if you can wear like bright colored shorts and then an opposing like tank top, a different color, so you can actually see the level of your pelvis. And then slow it down as you're running and see, does one side keep dropping down low? So seeing if you do run on a treadmill and there's a mirror in front of you, you can also see, does one bone go higher or lower than the other? And if you think about, like, there's two bones on the front of your hips here. If you envision like flashlights coming forward, your goal when you're running is to keep those flashlights level. So you don't want them bouncing like this when you're running. So sometimes if you think about like running under a low ceiling, so you're not bouncing up and down, getting a lot of forces this way, but so you're traveling straight forward, keeping that pelvis level, that can be helpful. So either having a friend take a look, taking a video, seeing if your pelvis is dropping, that can help you with some of your technique. The other thing is, like, yes, we need to strengthen those muscles, but also thinking about activating and your technique with your running. So like we just talked about, and, you know, using those kind of cues of running under a low ceiling, not getting a lot of up and down bouncing, that will help keep that pelvis nice and level. What's going on, Jay? How are you? Thanks for jumping on. So I hope that answered your question, Andrea. I appreciate it. I'm glad it was helpful. You're welcome. My pleasure. And so what are the specific, we talked about the specific muscles. Now, when you are strengthening those muscles, the key is that we can't just do the machines in the gym that we all love to do. So specifically, everyone probably on here has done these before. If you have, I want you to say, done them in the comment box. The seated machine, you kick your legs up, we work the quads. You sit in the machine, you kick your legs down, we work the hamstrings. You sit in the machine, you do the outer thigh muscles. You sit in the machine, you do the inner thigh muscles, right? So if you've done these exercises in the gym, don't be bashful, just let me know. Type it in the comment box, say, done them before, all right? Because it's very common, very common. Those machines are always popular. You know, there's like a line for them at the gym, right? So I go to the Edge here in Meriden, Connecticut, and you'll see a line for these machines. Now, if you are a runner, if you're a runner, the problem is when you're running, your feet are on the ground, meaning your muscles function differently when your foot is on the ground versus when you're in a sitting position, when your foot's not on the ground. So if you're only doing those exercises, then you're probably not strengthening in the best way that's going to optimize your mechanics, like we were talking about before, as a runner, as well as strengthening the muscles like they're intended to be used with running. So Dawn's on here. She's saying replay, but obviously she's on here now. So I'm imagining she's on the live, or maybe she's thinking about the replay. Maybe she jumped on live, and then she's going to go watch the replay. So thank you, Dawn. So Lisa wants to know heartbeats ticking. Peter, I'm glad you jumped on. Thanks for jumping on. Hope the information is going to be helpful for you. Kristen's on. Thanks for jumping on here. And I think, Lisa, don't let me forget about your shin splint comment. But going back to your shin splint comment, Lisa, is the hip muscles are actually the most important muscles that you can probably do to correct your shin splint issue. So shin splints, as a kind of brief aside here, just a little breakdown, can be due to a couple of different issues. So we have certain specific muscles that can cause shin splints, as well as you can have issues with the bone itself. So you can get some tibial stress syndrome of the actual bone, or in the worst case scenario, especially if you have added in a lot of mileage recently, then you could possibly have a stress fracture. So the difference with that, that's more of a red flag. You definitely don't want to be running with a stress fracture. You're going to have more localized, pinpoint specific pain, so you can kind of point to it on your bone on the front of your shin. That would be the stress fracture example. If anyone out there right now is feeling that sharp, localized pain, it will probably come on after a couple of miles. Then you definitely want to stop running and be seen by a medical provider. So let's talk, you can have tibial stress syndrome or issues with the actual muscle or tendon. So Lisa says she's a weekend warrior runner, so shout out to the weekend warriors out there. And if you have issues with the tendon or the muscle, most likely it's due to if your foot pronates a lot. So it kind of goes into that flattened position. Your foot hits the ground and you do a lot of this pronation motion, especially when you go to push off. So when you push off, your foot should be nice and stable. And if you are overpronator like I am, then your foot's going to roll a little bit more, puts more stress and strain on your posterior tibial muscle as well as the anterior tibialis muscle. And that can cause what we call a tendinopathy, basically a problem with the muscle or the tendon. The treatment for that not only is specific treatment to those muscles, so whether you're doing soft tissue work, dry needling, massage, instrument assisted, you're doing ice cup, you're doing KT, so you're using some taping techniques. So all those will treat the source of the pain, but the key is to get down to the root cause of the pain, which is usually those hip muscles that we were just talking about. So that should help you out, Lisa, with kind of the shin splints. And there honestly really is not a great stretch. There's only a good stretch if your calves are super tight. So if your calf muscles are tight, then that will also limit your ankle mobility coming forward, that you can roll over your foot. So then that might put extra strain on the other tendons along the lower leg. So if your calf muscles are tight, if your gastroc soleus complex is tight, then definitely roll that out, stretch that out. That will be definitely helpful. But there's no one kind of key stretch, I would say, that I commonly prescribe for someone with shin splints. It's usually treating the symptoms, checking out your training. So maybe cutting back a little bit, maybe cutting off the hills or cutting off the sprinting and speed work and doing easy runs, getting some treatment, and then addressing those root cause, which are these hip muscles that we've been talking about. So hopefully that answers your question with regard to shin splint. For those that just jumped on, I know we got different people jumping on and off here. So those that just jumped on, type any of your running related questions below. I will be happy to answer them. Tonight's topic is best exercises for runners. We've talked about what types of exercises, what specific muscles to target. And now we're really getting into talking about weight-bearing exercises versus the machines of the inner and outer thighs, the quad extensions, and the hamstring curls that you're doing in the gym. So we want to do exercises with your foot on the ground. Main muscles we want to target are the hip abductors, hip external rotators, the glutes, so your glute max muscle, as well as the calf muscle. A lot of times I find the endurance is limited in a lot of the runners that I see with running related issues. So making sure that you can perform 25 single leg calf raises, that you as a runner should be able to do that. You'll be surprised at how many runners that I see that cannot do that. So that's a nice test you can do by yourself. You can do that right now if you want. Stand up, stand on one leg, see how many times you can do a calf raise on one leg with your knee staying totally straight, without bending it, without compensating. So if you can't do that, then you need to work on the endurance and train yourself to be able to do 25 single leg calf raises. Glad this was helpful, Jay. Appreciate it. Andrea, I'm glad this was helpful. Nikki jumped on. Hey, Nikki, how are you? Thanks for jumping on. So we talked about calf muscles, and now we're kind of going to hip abductors, hip external rotators, standing exercises. So more where your foot is on the ground. So whether or not it is lunges, whether or not it is squats, and then also consider single leg activities, because running, you're always on single leg. So you can't only do your regular squats with 2 legs. You need to be able to do a single leg squat. You need to be able to do some other stability type exercises on 1 leg, using your quads, using your glutes, and that will help keep your pelvis nice and stable. So you're using that glute medius muscle we talked about before. So Dawn wants to know, how important is core strengthening and balance to running? Core strengthening, definitely important, especially for those who have instability in the lower back area. So meaning you were hypermobile. Maybe you were a gymnast, dancer in your former life, or you're just one of those kids who are very flexy and loose. Most likely you're going to have more mobility in your lumbar spine. So when you're running, there's a lot of pounding that goes on. And if you don't have the control of the core musculature, then that is going to impact your lower back, especially if you get low back pain with running. It is not the most common injury, but you do see it in some, having some low back pain symptoms with running. So that would definitely be one case on that I can think about, where core strengthening is super important. Then just expanding that core strengthening versus thinking about your traditional just abdominals and your deeper core muscles, but your hip muscles and your glutes, some would consider core strengthening. And I would say those are core foundational muscles that should be performed and worked on for definitely runners. Your other part of your question, Dawn, was fantastic, balance. So that really relates to the point I was just talking about with single leg activities. So whenever you're on 1 leg, we're really looking at your balance and stability. And that's why I use that word in the beginning as opposed to just saying strengthening, because there are a lot of exercises that you're going to do that are not only strengthening, but also stabilization exercises. So how can you balance on 1 leg? And now can you bend your knee? Can you do a reaching forward? Can you activate your glute? Can you use your quad muscle with good stability? And then that goes back to knee control. So kind of going back to that knee goes in business. So doing specific exercises on 1 leg will help you be able to control your knee. So then you're controlling it with running. So thanks for your question, Dawn. Rachel wants to know, how long does it take for patellar tendon to heal? I'm losing my mind. Oh my goodness. Yes. It's very frustrating, right? Very, very frustrating. Chronic patellar tendinopathy can be very frustrating, just like those that are out there who have ever experienced plantar fasciitis, heel pain, or Achilles problems as a runner. Unfortunately, these conditions can be very stubborn, especially if you are continuing to train. They do take a while to heal. So depending upon, Rachel, how long you've had this and how long you've had it before you went and seek treatment, it will take longer to kind of get better. So Glenn, thanks for jumping on Instagram there. Nice to see you. And these chronic tendon problems can take a while. So a lot of times I'll see patients where they come to me after having 3 months pain, 4 months pain, 5 months of pain, and they've been running through it. So it is going to take us a while for that to get better. So the first thing, Rachel, I would say is definitely seek out a specialist, a running medical provider in your area to get some treatment and get some guidance, because it really does relate, again, back to the root cause of the problem. Specifically for patellar tendinopathy, a lot of times it's those that are not hinging from the hips and their glutes are not turning on. So your glute max. So the opposing muscle group, patellar tendons on the front of the knee, glute max on the back of the hip. So a lot of times the glute max is not kicking in, not functioning, and it puts extra stress to the patellar tendon. So there are some great exercises you can do to allow that tendon to start to what we call remodel or heal. And a lot of times this treatment is actually designed, and the exercises are designed to add stress to that tendon. So the old school way of thinking, like when I first went to PT school way back when, was we needed to rest, ice, do anti-inflammatory stuff. But now we know a lot more. The science has definitely expanded in this area with patellar tendon issues, especially those that are chronic. And we know that actually exercise is great for this condition because we need to load the tendon in order for it to actually heal. So exercise and loading of that tendon in a progressive fashion will help it heal. But yeah, Rachel, like I said, seek out a good PT in your area. There are some great exercises to work on slow lowering, so eccentric protocols, heavy slow resistance protocols. So doing like 3-second lower, 3-second raise. If you're doing something like a single leg in a leg press activity, decline squats are another great activity that I'll do with my patients who have this chronic patellar tendon issue. So that is something that can be stubborn, so I feel you. There's been a lot of people who have been there before, and just be patient with it. Listen to your rehab provider, and you got to stay diligent with the exercises, and then slowly ramp back in your running. Lisa, yeah, 30 half marathons. That's impressive. Very, very impressive. Half marathon is my favorite distance myself. I think I have about 13 or 14, so I got a little bit of catching up to do. With you. We do have the Cheshire Half Marathon coming up locally for those who are local. Excellent half marathon, highly recommend it. I will be hopefully running that in 2 weeks from now, but we'll definitely be having our Spark Physical Therapy sponsorship there. So those that are going to the race, definitely stop by our booth. I would love to meet you, love to talk to you. So we do have another question here. Is the Stairmaster a good machine to strengthen all those muscles you mentioned? Stairmaster is actually a great machine to strengthen the glute max muscle. So that will help. And then as long as you're watching your knee alignment, think about keeping the center of your kneecap over your second toe when you're going up with each step. So your steps need to be deliberate. Sometimes I'll see people on the Stairmaster and they're just going up and down, not really thinking about what they're doing. Each step you take, you need to activate your glute and push yourself up. So you're feeling that in your glute muscle and making sure that the center of your kneecap is over your second toe, then that will definitely help to work those muscles. So yes, the Stairmaster can be very good as long as you're not having knee pain when you do it. All right, so we have another question here. Nikki, thanks for jumping on. First half of the year on the 28th, after 7 weeks off due to concussion. A little nervous about being prepared for it, having trouble keeping the IT band in check. Oh boy. So I wonder, Nikki, if you are running the Cheshire Half, because that is on the 28th, or if you are running a different half marathon. So the IT band issues, again, really, Nikki, go back to those hip abductor muscles. You need to be strengthening the heck out of them. So hip abductors would be great. If you do check out, I have a couple exercises. I will be posting more in my YouTube channel, Spark Your Training. Check that out. Playlist specifically for runners with some free exercises there. So there are exercises there, some TheraBand sidestepping exercises, loop band. I love to activate that side hip muscle, but it's all about IT band issues are keeping that pelvis level and strengthening the abductor muscle. You can definitely roll the front and the back side of that band. Do not roll directly over the IT band. I see a lot of people who do that. It is extremely painful, and I don't find it as helpful versus rolling slightly in front and slightly behind that IT band. That will be the best way to actually loosen that area up. All right, so we have another question here. Just got my mid back ice stim helpful. Okay, so we're talking about responding back, ice stim helpful. Linda, how are you? Good to see you, Linda. Going back, way back when Linda and I did a lot of knee strengthening years ago when I was actually doing my training in physical therapy school. We had the pleasure of working together, doing some training together. That was my former life as a personal trainer, strength and conditioning coach. So that's how I started my career before I went into as a physical therapist. So Rachel's scheduled to run a marathon in June 22nd. When I say run, I mean run/walk. I just want under 5 hours. Hey, that's pretty respectable though, Rachel. Hey, kudos to you. 26.2 is no joke. I ran one of them. So I did one of those and I cramped up at mile 20 like most people do on their first marathon. 26.2 is not anything that you should be ashamed of at all. That is a huge accomplishment. So kudos to you. It sounds like you're staying relatively healthy. So that is phenomenal. All right, so going on. What types of exercises? We talked about that. So should you stay away from heavy weights? So this is kind of a quick point here. Timmy, thanks for jumping on. Quick point here on staying away from heavy weights. Should you stay away from them? No. However, you don't want to do too much, especially during high training volume season. So meaning if you're really running a lot of miles per week, that's not when you want to ramp up your heaviest form of training. You want to think periodization throughout the year. In the winter months, if you're usually running a little less in terms of mileage or in terms of speed work and not running as hard, then that's when you want to really work on increasing your power and strength. So that's when you want to do your heavy squats, deadlifts, adding heavier weight. During the time of the year when you're running a lot of races or you're adding a lot of mileage, right? Typically, most of us, that's the summertime, right? It's beach season. We got to slim down a little bit. So we're going to add more mileage. Maybe we're going to hit the track. We're going to hit some speed work. We'll do some tempo runs like we talked about in last week's live. Then that's the time where you do not want to start ramping up heavier weights in the gym, just because that's probably going to be too much load for your tissues. And then that's when you're going to start to see some of that running related injuries that we see and some of those overuse type injuries occur. So I definitely think we want to strength train. Don't think that you're going to bulk up and you're not going to be able to be a runner. We need strengthening, and we need to have proper strengthening in order to run healthy. All right. And then lastly, last point, how many days a week should I exercise? I get that sometimes. It really depends upon how many days a week you're running. In general, you should be doing some type of strengthening or stabilization exercise that we just talked about before, at least 2 to 3 times a week. So at least 2 to 3 times a week. And it doesn't mean all of the exercises you need to do every single day. You can do certain exercises on one day. So for instance, like myself, if I'm working my hip abductors, I might do a lateral pelvic drop exercise with the kettlebell in hand on Mondays. And then I'm going to do my resisted sidestepping with my band in my Friday workouts. My Wednesday workouts are always plyometric day. So there I'm focusing on side to side hopping, keeping my pelvis level, kind of working agility of that hip abductor muscle. So think about 2 to 3 times a week, hitting those key running related muscles 2 to 3 times a week. So if those of you who stayed on, this went a little bit longer than I thought, but I thought we had some great questions in here. Those that are on the replay, definitely type your running questions in the comment box. I will answer you. If this information was helpful for you, what I need you to do right now is to hit the like or love button. If you do that, there'll be more people like yourself or runners out there looking to stay healthy, looking to stay happy, that this can certainly help. All right. So hit that like or love button. It will definitely help it reach more people. And if this was helpful for you, just type in helpful, just so I know this was helpful. It wasn't a waste of my time. Hopefully it was worth your time for tuning in. I'm glad that I can be a resource for you. I really have a passion for helping runners stay healthy, hit their running goals, be a winner, hit their successes, whether you're going to run, walk 26.2, or you're going to start a Couch to 5K program that I just talked about with someone else earlier this week. So whether you're or you're going to go PR your marathon, your 26.2, and you're looking to get your under 3-hour marathon time. So any of those runners, I have a passion for helping. And if you are in the Cheshire, Wallingford, Connecticut area, and a lot of the things that we had talked about are things that resonates with you. I've helped a lot of runners around the area hit their goals, whether it was just starting out or getting PRs at races. So if this is something that interests you, I would encourage you to check out sparkyourtraining.com. That is my website, and you'll be able to find information regarding availability, cost right there. You can also shoot me a DM. I'll be happy to answer. I love when people jump out. David, thanks for jumping on. Aaron, how are you? Good to hear you. Good to see you. Nikki says that she feels you, Rachel. She's struggling to get back into the swing of things, but hell bent on completing the half on the 28th. So let me know what half that is. I would love to hear about another half on the 28th. So thanks for those that jumped on. In this video, we did talk about the best exercises for runners. We talked about what types of exercise you should be doing. So it's going to be a balance of strengthening, stabilization, flexibility. We're going to get to the flexibility piece next week. We're going to hold back for the soft tissue care. All right. So if you voted soft tissue care, you're going to get your soft tissue care. That's next week's topic. Stay tuned. And then plyometric training, which we've already talked about, level 1 plyometric training a couple of weeks ago. So that's going to be your balance. And then your exercises are not only going to be in the gym, sitting down, kicking your legs up, kicking your legs down, bringing your legs out and in on those machines, but they're going to be standing weight-bearing exercises. So those standing weight-bearing exercises are going to translate into what your muscles need to do when you're running out on the road. We talked about, should you stay away from heavy weights? No, you should not be scared of heavy weights. You should be doing heavy weights, but you need to keep in mind how much load you're doing with your mileage during the week. All right, so you don't want your highest, heaviest load in the gym with heavy weights during the season or the time period when you're running your hardest. And then about your exercises 2 to 3 times per week for those key muscles. Again, those key muscles were your hip abductors, your external rotators, your glute max, your quads, as well as your calf muscle. So that are the key exercises. I thank you guys so much for jumping on here today. I appreciate all of your questions. Rachel's icing right now. She's getting sick of it. Think about some of those root cause contributing factors. Rachel, make sure you see a good healthcare provider in your area, because I feel for you right now. I want to help you out, and so you can run happy and healthy. So I hope everyone has a great night. Again, if it was helpful, type in helpful into the comment box. Hit the like and love button. It will help more people see this video. I hope everyone has a fantastic night. Thanks again for tuning in. Bye-bye. Will I hit the end? I don't know. What do you think?